Colorectal cancer, commonly referred to as colon cancer, is the abnormal growth of mucus-secreting cells, or an adenocarcinoma in the large intestines. You may hear about colon cancer often, but you never necessarily hear the severity of the disease. That is because colon cancer is one of the most easily prevented and treatable cancers. Despite this fact, however, colon cancer is actually the second leading cause of cancer-related deaths, and over 150,000 people die from colon cancer annually in the United States. Why is it that one of the most treatable cancers could also be responsible for so many deaths? First, one has to understand that diagnosing and treating the cancer in its early stages is absolutely crucial. Colon cancer generally starts as a small polyp in the intestines formed from an abnormal growth of the mucus-producing cells in the lining of the intestinal tissue. Though polyps start out benign, constant stress on the body will easily cause these polyps to become malignant tumors or cancerous cells that will then begin to affect one's health, because the colon is directly linked to one's immune system and lymphatic function and absorption of nutrients in the digestive system. And when those systems are compromised, common physiological symptoms such as chronic pain, constant fatigue, hair loss, incontinence, and some internal effects such as osteoporosis, infertility, and a risk in developing another type of cancer begin to show up. Many people believe that colon cancer is more commonly found in men. However, colon cancer is actually not gender-specific. Medical records show that 1 in every 19 men and 1 in every 20 women develop colon cancer in their lifetime. Therefore, colon cancer is increasingly dangerous, not because of gender, but due to a common unhealthy diet, especially for those with a diet high in red or processed meats. One will also have an increased risk in colon cancer if they are older than 60, are of African or European descent, or have a family history of colon or breast cancer, or have one of the following diseases: lymphoma, melanoma, inflammatory bowel disease, ulcers, hemorrhoids, or if you have FAP, otherwise known as familial adenomatous polyposis. Don't laugh, this is serious business. In addition to all of this, anyone with constant or large amounts of stress in their life will also increase their risk for colon cancer dramatically. Despite being generally at risk starting at 60, it is highly recommended by many physicians to begin examination for the colon around the age of 50, or 40 if you are already at high risk, and schedule a colon examination at least once every 10 years, because for those who catch their cancer within the first 4 stages of colon cancer, more than 90% of them can be treated and cured. However, for those who are in the last stage of colon cancer, less than 10% of them will survive. However, whenever your doctor cannot be there for you to perform a fecal occult blood test, know that if you ever begin to have chronic symptoms of abdominal pain and tenderness, blood in the stool, diarrhea, constipation, any incontinence and bowel movements, narrow stools, black or tar-like stools, or unexplained weight loss, you will definitely want to be screened by a physician as soon as possible, because each stage of colon cancer has different treatments. Also remember that many other diseases could also develop from an unhealthy colon. The first stage, known as stage 0 for its benign nature, is when the cancer only lies within the few cells in the innermost layers of the intestines and appears as polyps which can be removed easily during a colonoscopy or sigmoidoscopy. The next stages 1 and 2, measure the degree of how far the cancer has spread throughout the muscle wall of the intestines, and will be treated with extensive surgery such as a colectomy and small amounts of radiation treatments to remove the cells. Then the final stages 3 and 4, are when the cancer has become systematic and spread from the colon to mainly the lymph nodes and liver. Stages 3 and 4 can undergo adjuvant chemotherapy for 6 to 8 months using common drugs such as irinotecan, oxaliplatin, capecitabine, and 5-fluorouracil in combination with other drugs to improve symptoms, or they can be treated with large amounts of radiation treatments, such as ablation or cryotherapy to cure stage 3 cancer, but can only prolong survival of stage 4 cancer. The moral of this video: take preventative measures against colon cancer by eating healthy, attending regular colonoscopies and screenings after 50, and taking care of your body in order to live a long, healthy life. Thank you for watching.